record this.
Oh, okay. All right. Basically, on the back here, you're going to have filters. All right. You're going to have two filters. One of the filters, you're going to have your white filter, which is actually going to go in here first. Okay. Then the second filter is your gray filter, which you're going to put on top of this, okay? And you're going to let it sit there because it's going to entrain air. Do not let anything on front of that, okay?
So that's going first.
The white is going to go first, and then the gray one is going to go on top of that. Okay. Now, once a month, you're going to take out the white filter and throw it away, and then go back and replace it with the new one. This is your bag that is actually going to come in, and you're going to have some little extras there. If you do not have any extras, then you're going to continue to just throw this, excuse me, you will go ahead and throw the white one away and continue to use the gray one, okay?
How often do I change this?
Once a month. I'm going to give you a little, I'm going to give you a little handout so you'll have for your personal thing. Now, right here, this is where your SIM card is. And this was basically monitors your usage of the machine, okay? Then, remember, you're going to get that modem first. It's going to be a black box that's going to sit right here. They're going to have an antenna on it. And it's basically just going to monitor. And where's it going to mount? It's going to plug into this? No, it's going to sit right here.
Oh, it'll be on the machine.
It's going to be on the machine that you're going to get, and it's going to have a little antenna. Do not mess with that modem until they actually call you and say, okay, you can take this out, and then they're going to send you a box to mail it back to Egan, okay? And then you're going to continue to use your SIM card.
So I don't have to turn that off or on. It's going to be automatically on.
It's going to be automatic because it's going to be monitoring you the whole entire time, okay? And then
it doesn't matter about my sleep being different than most people. I sleep during the day, so it's...
Oh, it's no problem with that.
It's not going to say, well, he didn't sleep last night, he's not using the machine.
Right. It's whenever the 31 days of the month, it's clocking of how many days that you should do within the day. So
now it's going to recognize that I'm using it once it's turned on. And
correct. It's only going to monitor you once you turn the machine on.
Oh, okay.
Yeah, once you turn the machine on, but you need to make sure that even if you're working at night and then come home that day, you want to make sure that you're using it that day. Okay.
Oh yeah, I'm going to use it every day.
Okay. Also, right here, you're going to have your plug. Okay. You're going to have your plug that you're going to actually slide in your power source. Now, also, your power source, you're going to have this little part here that actually goes in, and then you're going to have your little part that you plug this in right here. Okay, so just plug it in and make sure that you do plug it into the wall where your power supply. Yes, make sure that it's plugged into somewhere safe, nothing that is power overloaded. Okay, now when you spin it around here, all right, on this side over here is your water chamber. Basically, you're just going to flip this up with the finger just like that, and you're going to pull this out just right here. Now, this is your max line that you're going to fill with distilled water. You can use distilled water, bottled water, or purified water, but just don't use tap water in this machine.
Now, I have one of those Brita purifier.
That's the purifier. So basically, you turn the purifier on and fill it up every single night or whenever you sleep, right before you go to bed.
Okay, so that's going to require a refill every night.
Every single night. Every single night. Okay, and then
goes through that much water. Well, I guess so. It's constantly blowing. Yeah.
No, what you're doing is you don't want to use the same water over and over.
Oh, okay.
You want, because of the fact that bacteria has sat all day, and you want to basically open it up now.
See, that makes me wonder now. Like, those coffee pots where you leave the water in all the time. I bought one of those. What are those things? You put the single cup of coffee in?
Right. Yeah, we have one too. But you have to kind of.
Yeah, but that water sits in there all day, and I've been hearing stuff like that's not very sanitary.
It's not. So that's why we tell you to go ahead and change.
You can't really empty those things because unless you turn the whole thing
over. I know.
I bought one because it's convenient.
It's very convenient.
But
yes.
Now that you say it with this
one, you're gonna make sure
you're blowing this stuff into your nasal passage.
Correct.
You don't want contaminated water in there.
And you don't want that. And so that's why they do require you to actually pour out the water and make sure that you put in fresh water every day, every single night. But basically, the way you open it, you're just gonna take this little hinge. It's like a little hinge there, a little latch rather, and you're just gonna squeeze, like press in and lift it open just like this. This is this little part right here is what you're squeezing on, and you're gonna pour the water in there, and then get back on the hinges, right? To put it back on the hinges and close it up and snap. Okay.
Now for cleaning on this, is that
now
something
the
you can
cleaning
clean in the
will
washing
basically
machine?
no, sir. What you're gonna clean
Soapy
with
water.
this one, you're gonna use white vinegar and water. Okay, so grab you a jug of vinegar.
I got vinegar
and
to
so
flush out
what you're gonna do is use 1 to 1, 1 cup to 1 gallon of water, and open it up and let it sit for about 5 to 10 minutes, and just basically let it cover up to get all that out. You can just take a little rag.
And how often do I do that?
You're gonna do that every week.
Okay.
Okay, once a week. All right, and once a week you're gonna clean all of your supplies, all of your external supplies. All right, so you're just gonna clean that out and let it air dry. Okay, but then you're just gonna close it back up and put it back together for that night. Never pour the water straight in, because all the water will come straight out here. Okay, so don't just pour it in here. It'll come straight out this hole right here, okay?
So you got to take the top off of it.
Take the top and then do that. Now to put it back in, you're just going to basically slide it right on back into there and push it in and close. All right? Now, over here on this side, you have your little knob right here. All right? On therapy, if you can see here, this is where you actually use to operate your machine, okay? Even if it goes on to this side like this or for some reason, it's going to come back to therapy. All right, now to turn the machine on, you just simply mash the button right in the center. Your machine will
predetermined that
10 is what your doctor wants you to be on.
Is that the amount of air that's blowing, or is it like the pressure?
That's the 10 centimeters of water. Yes, how much pressure that's going to push in to maintain your airway. And that's what your doctor wants you to be on, to eliminate all your vents and also eliminate your snoring. Okay.
Oh, I did snore?
Evidently you did. I don't know all the results, darling. Evidently you did. You did.
I meant to ask that from the woman. Like, could she hear me? Because I got this little music thing so I could sleep better.
Sleep better, yeah, so you don't hear yourself.
She could hear that, but I meant to ask her, like, how bad do I snore?
Oh, my goodness. Now, this is right here, this is 10 centimeters of water of how much pressure that's actually going to go out. Now, this button right here is your ramp button, and what it's doing is basically you can just mash this button right here, and that will lower your pressure down to 4 centimeters. Okay, now that's the lowest point, and what it would do is within 30 minutes it will gradually increase back up. Now,
what if the pressure's too much and it's bothering me? Is that the only reason you would do that?
That's the only reason that you would do that.
Okay.
Okay.
So if you have like a blocked passage, like a clogged up nose, I mean, it's going to be hard to take a lot of...
Sometimes it's hard for you to do that, but whatever whatever you do, once you mash the button, it's going to gradually go back up. Okay, each time. And it's for patient comfort, so that you can kind of get used to the pressure, and then sometimes you may not even need it. If you don't need it, you don't have to mash it. It's just there, just in case. Okay. Now this little button's right here. If you can see this dial going around, 0 is no. That we're determining your humidity over here right now. You would just swivel this around 1, 2, 3. That's how much humidity that's coming. Now how you determine that is, it's already going to be set on 2. That's giving you just a little humidity, okay? Not that much, kind of cool, not that much, okay? But if you wake up,
by humidity, it's giving you the water into your...
It's just basically moisturizing your airway because of the fact that this is a compressed air. Okay, and you want to actually add a little humidity, because you will dry out. Your mouth will become dry in the morning. Now, if your mouth is really chalky dry, you want to increase on up to 3, 4, or 5, and that's giving you more humidity.
Every time I wake up, my mouth's so dry.
So then basically you want to at least use between 3, 4, or 5, so that your humidity won't be, so your mouth won't be as dry. Now, you still may experience some dryness, but it won't be as bad if you didn't use your compressed air. Okay, so basically you can use this whatever you want. Now, whatever is set on, it's going to be set until you actually make those change. This is on the humidity part, you can change that. Okay, and that's whatever you want, but it'll come to you set on 2. Okay, now
how did you get to that button there? That button
is this button, mash it.
Okay.
That turns it off.
Okay, that turns it off. Now back on.
Okay.
That's that.
That is going to be set on 10 centimeters of water.
Okay, now to do
twist
this thing.
Twist it.
Oh, like that?
Yeah.
Okay, so
twist it.
Okay.
Mm-hmm.
So however I set that, it's going to, now you just start going.
And every time you turn it off and turn it back on, it's going to be on whatever you set it on.
All right.
Okay. Now, how did you turn your ramp on? How did you mash your ramp? You remember I told you that just in case if you don't want that pressure coming to you, what button do you need to mash to lower the pressure a little bit? Good. That's your ramp button for your patient comfort, okay? If you don't want all that pressure coming to you at once.
Just hit that and back off a little bit.
And then how do you change your humidity to control this over here?
Right.
Good. One,
yeah,
2, 3. Really there you go. Okay, and so you on and off button. I can't
figure that out.
Trust me. It has been times that they don't know. But other than that, that's your whole entire machine. Now you are going to receive a 6-foot tubing.
Oh, that's good because.
Okay, and you want to make sure that you're level to the bed, nothing too high, nothing too low. But you want to make sure that you either end, one end is going to go to your machine, and it has a little swivel on there, and the other end is going to actually go to.
That's
your,
how long it is.
Yes, 6 feet.
That should be good.
Yes, 6 feet. All right. One end is going to go to your machine, and one end is going to go to your mask. So we're going to go ahead and try to fit you for the mask now. Okay.
So either end,
and it's just gonna slide right on in. It doesn't matter which end you do. All right. While we got that on. Now, hold on the recording. Now, on the cleaning, remember that you're going to clean your humidifier with white vinegar and water. You're going to open it up and just let it sit for 5 to 10 minutes, just once a week. And then also your tubing and also your mask. You're going to wash with warm soapy water, whatever mild dish soap that you have, rinse it and let it air dry. Okay?
Once a week on that too? Or?
Yes, all your external supplies you're going to use, even your filter, just your gray one, not the white one, just your gray one. You're going to wash it with warm soapy water, rinse it and let it air dry. Right. And then you're going to put it back on your machine back there in the back. Okay? Back in the back.
Right.
Right here. Okay?
Over top of the other one.
Yes. Okay, and then also once a month you're going to take your mask and you're going to disinfect it with white vinegar and water. Okay, now never use any alcohol or any bleach on any of your equipment, and don't use those towelettes on there also. You're just going to, sometimes this machine does get dusty, so take a damp cloth and just wipe it off. Okay, now mask usage, we're going to determine which mask did you want. Did you want to try this one?
Is that the full mask?
Yes.
Yeah, let's try that.
Okay. All right. If you want, you can hold that, and then we're going to